Good morning. So last night at dinner, I had a lesson in public speaking. I couldn't imagine how this fellow could give the entire speech from memory, and then I realized, being a musician, that he'd practiced many times. I have not practiced this opening statement at all, but Scott, I want to ask everybody, imagine how you would feel if after 18 centuries of innovation in sterilization, you could not get an appendectomy in most parts of the world without sterile instruments. How would you feel? Maybe you should write a letter to the Secretary of HEW or HSS and complain about that. I'm going to talk to you today about innovation and about the history of sterilization, which is not sterile. Trust me, it's not sterile. It covers 18 centuries of history, and what's important to remember is that it has not yet solved the problems of the developing world, but it does teach us a few lessons. It teaches us that knowledge does not necessarily synchronize with practice. Sometimes practice is ahead of knowledge, sometimes knowledge is ahead of practice. Innovation often is not what the innovator imagined it would end up being. There's ample evidence of that in the history of sterilization. Innovation is never met with applause. It's usually met with resistance, and it takes a long, long time. A long time, as you will see this morning. And finally, I'm going to talk to you about the latest innovation in sterilization, which will have a long, long journey just as well. So our story starts in 200 AD with Galen. And what you're looking at here is a famous squealing pig demonstration in the public space. Anatomy, cutting the laryngeal nerve of an unanesthetized pig who squeals until the nerve is cut. But this fellow Galen was also a doctor at the gladiator school in Pergamum, and he was very proud of the fact that if he soaked open wounds from gladiators cutting each other up, they didn't get infected. Imagine that, 200 AD, topical disinfection demonstrated successfully by Galen. And nobody did anything about that for a very long time. Practice in that case was way ahead of knowledge. For the next 16 centuries, surgery was barbaric. It was a necessary evil and inhumanity. There was no anesthesia. There was no antisepsis. In fact, there was one case reported where the surgical mortality from an amputation was 300%. The surgical assistant got cut and died of sepsis. The patient died of sepsis. And an observer died of shock watching this procedure. We then get to Semmelweis. I'm sure you all recognize this fellow. He was a very cantankerous man. His motivation was not what you might think. He worked at a maternity hospital where there was 20 to 30% incidence of puerperal sepsis. Okay, that was bad news. He went away on vacation, and his best friend was doing an autopsy. He got a cut on the finger and died of sepsis. And Semmelweis was very upset by that and put his good mind to work and tried to figure out, why did his friend die? Women in the audience ought to understand that this was not about women, this was about men then. Why did the man die? When he had all these women dying all the time, he wasn't thinking about that. But when his friend died as a man, he wanted to get interested. And he figured out, with the first case control study ever done, I think, with good data, that the doctors and the medical students coming from autopsies would deliver babies and the mothers would die of sepsis. But the women who were delivered by women, midwives, the midwife students, they did fine. Why was that? Well, there was something coming from the cadavers of dead women who died of sepsis that was being transmitted back to the mothers who were delivering. Hand washing was a solution. Hand washing, 1847. Hand washing solved the problem. Those of you who left the hotel this morning saw a little hand washing device by the door. Puracell, wash your hands. There's several posters here about hand washing behavior. Innovation takes a long, long time to be recognized and to be accepted. Semmelweis did not meet with applause. His professors, his old gray professors, said, young man, you don't know what you're talking about. Infection comes from miasmas, which are shown here in the lower right-hand corner. Semmelweis accused them of being murderers because they didn't accept his approach, and he was sent off to a mental hospital where he died of sepsis, you guessed it, from a cut finger. There's a lot of irony in the history of sterilization. We then come to Pasteur. All of you know about Pasteur and fermentation. That's well known. But Pasteur also got involved in a theologic argument that had been going on for a century about the origins of life. The theologians said that life was a spontaneous thing that just appeared in broth and in the world. Pasteur said, oh no, I think that life comes from life. And he set about to prove that. It was a theologic argument. He wasn't interested in surgery. So he did a bunch of famous studies where he sterilized broths and urine and wine. And there was no growth when he got done. He boiled them. But he had a nemesis who was also an academic who was out to disprove Pasteur, and he did disprove this. He took the same broth and he changed the pH, and lo and behold, growth occurred. And they said, oh, you see, Dr. Pasteur, you're wrong. And Pasteur, being very upset, called one of his assistants, whose name was Charles Chamberlain. And he said, will you bail me out and help me figure out what's going on here? And Chamberlain did. He built an autoclave, and he superheated water to 130 degrees, killed the spores that were growing, and demonstrated unequivocally that spontaneous generation did not exist. Now, where did Chamberlain get his autoclave from? 200 years earlier, a Frenchman who worked at the time of Boyle created something for cooking food. It was called the Papin steam digester. It was an autoclave, but it had a bad problem. It would blow up and spray food all over the kitchen. So Papin devised a little valve at the top of his steam digester. And while he was looking at the valve, this is all about innovation, while he was looking at the valve, he said, you know what? I think I can make an engine out of that. And he wrote it up, and he gave it to a friend who didn't bother, but that became the steam engine of James Watt. So from steam digester to autoclave to steam engine. My point that innovation sometimes ends up where it's not expected to end up. Robert Koch, well known for his postulates, which we all know, also described the human body as an incubator, very important. And he also said we should not autoclave surgical instruments because they'll be damaged. He was the father of material compatibility studies for sterilizers, not known. Koch, being a stubborn fellow, finally figured out that autoclaves were good, so he put his name on them. So the man who opposed them finally called them the Koch autoclave. Not unlikely in that time. So now we come to Lister. Those of you who go to the drugstore and get Listerine know what Listerine is. Lister was a very famous surgeon. He was so famous that lectures were named after him. A fellow called Watson Chain, one of his residents, wrote this amazing story of Lister, which is available on the internet, which I really commend to all of you to read. It is an amazing detective novel and describes all the things that Lister did. One of the things that Chain said, which you can read in yellow there, is that nothing major happened in the treatment of sepsis until Lister came along. What did Lister do? He actually used his head. He thought about things, and he said, okay, so I'm looking at compound fractures. They get infected. Why? Well, there must be germs in there, so I better kill the germs in the fracture. So he did a lot of experimentation, discovered carbolic acid, packed his wounds with carbolic acid. They got better. And then he said, well, wait a minute. When I'm doing elective surgery, I also get sepsis, so maybe I should try and keep the germs from getting into wounds when I'm doing elective surgery. So he developed a carbolic acid sprayer, which you can see up in the corner there. Now, Anna talked yesterday about her nebulizer with a foot pedal. Well, if they'd had a foot pedal then, a lot of residents would have slept a lot better because their job was to sit there and pump the sprayer by hand while the great Lister was changing dressings and doing surgery, and they fell to their knees in exhaustion, pumping the carbolic acid. So Anna, I don't know where you were then, but they could have used you. Now, who's the gentleman in the corner there? The king, King Edward VII. Why is he there? 2 days before he was coronated as king, he got appendicitis. Appendicitis in those days was a very bad thing to have. The surgeon said, "Edward, you're a goner." Edward said, "Call Lister." Lister came and said, "I think we can do this. We can drain this appendix. We have to use my procedures." Edward said, "No way." Lister said, "Well, sir, you have a choice. You can die or you can be king." Not much of a choice, so Edward said, "Okay, I'll be king." He had his appendix drained. The next morning, he was described as sitting up in bed, smoking a cigar. And 2 months later, he was coronated. So Lister was a very important fellow. He was different than Semmelweis. He knew how to sell. He knew how to promote. And so he had a lot of followers. This gentleman here was one of the followers. For those of you who work in emergency rooms, how would you like to be the surgeon for the Austro-Prussian War? If you think your emergency rooms are bad, have a look at that scene. He had plenty of people to work on. He was the first person to use sterile instruments. He boiled his instruments. Lister then, on his promotional tour, goes to the United States. He goes to Bellevue Hospital in New York. In the audience is a young surgeon called Halsted, who we heard about this morning. Halsted says, "This is great stuff." He goes off to Hopkins, and he becomes professor of surgery. Now, everybody knows about Halsted and the rubber gloves, right? Well, the story is wrong. Halsted fell in love with his scrub nurse, who became his mistress, and they were using carbolic acid, Lister's carbolic acid, and dear Caroline got a bad contact dermatitis. And Halsted, ever being the chivalrous gentleman, persuaded a friend of his at the Goodyear Rubber Company to make a pair of rubber gloves for dear Caroline, who wore the gloves, and then the other nurses wore the gloves. And for 3 years, nurses wore rubber gloves at Hopkins so they wouldn't get contact dermatitis from carbolic acid. Finally, one of the young doctors there, Dr. Bloodgood, said, "Wait a minute." And his quote was, "What's sauce for the goose is sauce for the gander. If nurses can wear gloves, what about surgeons?" And Halsted is reputed to say, "What? Why didn't I think of that?" So the rubber glove that became associated with Halsted, really, we should thank Caroline for that. So here we are, the end of the century. What we have is autoclaves that evolve over time. And one of the points I'm trying to make today is that innovation is a long journey. So the original steam digester, Chamberlain's autoclave, 1950, the American Sterilizer Company comes out with a commercial autoclave. And today we have what you see in the lower right-hand corner, very, very high-tech autoclaves. Long, long, long journey. Then we go for a long period of time, almost 50 years, with no innovation at all in sterilization. And along comes the alkylating agent, ethylene oxide. And once again, innovation is a slow process, never quite turns out the way the innovator thought it would. And in this case, practice is way, way ahead of knowledge, way ahead, because this was used to sterilize in these two formats, and then it was carried on into big commercial contract sterilizers. And then, only then, did somebody say, "Wait a minute, I think this gas could be carcinogenic and mutagenic." And so they had to develop something to wear on your lapel to see if you were getting exposed to this nasty gas. And then two big explosions. When do you think those explosions occurred? The gas was introduced in the 1950s. The explosion in the lower right-hand corner was in 2004 at the Sterigenics sterilization facility, and the one on the left, 2009. So ethylene oxide now has to be in explosion-proof facilities, not the kind of thing you're going to take to the developing world. In fact, most of the innovation which you're going to see going forward is not applicable. This is the last applicable serious contribution to something which could be used in the developing world, chlorhexidine, which replaces carbolic acid. Hydrogen peroxide. The patent for hydrogen peroxide is 1972. It did not hit the market for 20 years. What was happening for 20 years? What was happening? Both Johnson & Johnson and Steers write at length about the difficulty they had getting people to use it, getting the FDA to approve it, and now it's used all over the world. Very slow. And now in the 1990s, here's something which we should put in Africa tomorrow, right? This is an entire square block. This is gamma radiation sterilization. And then we have E-beam, even bigger and more expensive in the 1990s. And that's it, until just this last 10 years. Look how little innovation has actually occurred in something which is a critical part of surgery. Almost everybody talking, who I've heard talk about surgery in the developing world, has mentioned the problem of sterilization. It's still a problem all over the world. All of the new technologies that are developing can't be used in these sterilizers. So there's been a real shortage of innovation. In 2004, a company called Noxalizer came up with NO2 as a new sterilization technology. NO2 is a very, very well understood gas. It's been around a long, long time. It is yellow. It has a lovely characteristic of boiling at room temperature. That means that when you immerse something in it, it aerates rapidly. There's no residual toxicity at all. It's also easily tested because the most resistant organism for it is the spore there that you see on the screen. For those of you who live in Salt Lake City, you must be extremely familiar with NO2 because it's what causes the yellow smog that you see here over your lovely city, probably in January, and the view of that fog bank from up in the mountains, caused by NO2 coming out of the exhaust pipes of cars, NO2, hydrocarbons coming out of the gas tanks of cars, the sun's energy working on them to produce ozone. So NO2 is a bad gas in the field of environmental health and has been abundantly studied, which is really very, very good because almost everything is known about this gas. If you're going to make a sterilant gas and you're going to make it available to all of you to use, you better be sure that it's safe and it works. And the FDA and international organizations have 5 steps that you have to go through to do that. And they're listed here. You have to know what the gas is. You have to know how it works. You have to know what the most resistant organism is. You have to know its material compatibility and toxicity effects. And you better know the sterilizing cycles. And you better be able to measure it with indicators when you use it. All of this has been done for NO2 over the past 9 years. 9 years and over $70 million to get that far. Innovation is not cheap. It's slow. It's tedious. It's never done by one person. It's done by whole organizations today. NO2 is effective, it's safe, and it's proven. How does it work? It's not an oxidizer like hydrogen peroxide. It's not an alkylator like ethylene oxidizer. It doesn't denature proteins like boiling water. What it does is it breaks single strand of DNA. 2 strands in the alpha helix, it does single strand breaks, and when there are enough of those, the whole DNA molecule folds apart. And this is demonstrated on these gel studies here, for those of you who know how to read gels. It has a log linear relationship, survivorship and dose. That's a requirement for a sterilant. The bigger the dose, the longer the exposure time, the more it kills. And you can figure out very precisely what the right dose is for sterilant. That has been done in detail for NO2. Sort of reminiscent of those late-night TV ads when they're telling you about the awful effects of drugs, but they show you these lovely pictures. I thought that's what I would do here. NO2 is safe, it's effective, it doesn't blow up, it's not inflammable, it has no residual cytotoxicity, there's no need to air anything out, it works at room temperature, and it can be used very safely. Now, who was that looking out with great amazement through the slide? For those of you who've been paying attention, that's none other than Robert Koch, who is totally amazed by the material compatibility profile of NO2. Almost everything that's being used today in devices, in diagnostics, in instruments can be sterilized with NO2. Plastics, adhesives, all sorts of things. And for those few things that don't work with NO2, they're actually design alternatives. All right, let's switch gears. That's where we are. Portability and ability to use this independently in low resource areas has been a problem the world has faced since the time of Galen, and it's never been solved. Here we have three lovely attempts. Upper right-hand corner, First World War. On the left, Second World War. Lower right, Big Bertha. It is the US military's current portable sterilizer. Requires kerosene, weighs 450 pounds, put it in your backpack, carry it with you on one of your trips, and uses 5 gallons of water. Try that in South Sudan. So this is the best we've been able to do to date. Okay? It's a tragedy. 150 years of innovation in sterilization, and what we have today in the developing world is what you see in that picture. On the right, today, on the left, Halsted in the 1880s. I don't see any difference. Do you? Why do we need portable sterilization? We know now, population explosion, changing face of disease, no electricity where these things are happening. So what is the solution? It is not disinfection. We were taught that by Lister, by Pasteur, by all sorts of people whose faces you know. So what I'm going to show you now, it takes 40 seconds, is a demonstration. We're now going to demonstrate the Anywhere portable sterilizer. This particular form factor is a 25-liter Pelican case. We're going to sterilize a group of primary care surgical instruments. Take the tray, take the instruments, put them in the tray, scalpel, some forceps, a few syringes, another forceps, and some additional tools. Take the whole tray, put it in the case. We then put in a scrubber into the case to absorb the gas at the end of the cycle. And close the case. Then we take the NO2 cartridge, put it in the case, and now we're going to puncture the gas cartridge. Fills the case full of NO2 gas. We wait an hour. It's now safe to open the case. We open the case, and we remove sterile surgical instrument. So, let me close by reminding you what I started out telling you, which is it takes many, many people to create a useful innovation. No one person does it. One person's idea ends up being a different outcome. These are some of the people who have taken us as far as we have come. I think you now recognize most of them. I want to remind you that knowledge and practice are always discontinuous, that the person who thinks of a great idea, generally the idea ends up somewhere else. It takes a lot of tenacity to get an innovation accepted because there's always resistance, and it takes a lot of teamwork and a lot of time and a lot of patience to make an innovation useful. I'd like to close with two thoughts. One for the medical students in the room who I appreciate coming here during exam time. When I was a medical student, I had a great professor of orthopedics, Preston Wade, who gave 10 lectures on orthopedics. At the end of 10 lectures, he said, "You're all going to get an A in the exam. Now I would like to have all of you please forget everything that I taught you, because innovation and progress in medicine is impeded by habit. And if you just try and remember what I've taught you and you don't use your intellect to discover new ways of doing things, we will not be well off." Henry Thoreau had the same idea for students. So students, don't memorize. I know you're doing your exams now, but learn to use your minds and learn to think and solve problems. And then for the rest of you, I would leave you with this thought. I'm an unreasonable man. I would urge all of you to be unreasonable. George Bernard Shaw said, "The reasonable man adapts himself to the world. The unreasonable man persists in adapting the world to himself. Therefore, all meaningful change is made by the unreasonable man." So I urge you all to join us in trying to make this embryonic technology come to life somewhere, probably in another form, and be unreasonable. Thank you very much.